We are with Marissa Gatfield of Canadian Blood Services. She is the territory manager for Windsor-Essex. But one caveat, because this gets sent out, around the world, North America is, a lot of what we're going to be talking about today is applicable across Canada and the world. Everybody, I'm sure every blood service and everybody, can and should be donating blood if they can. But we're going to talk about it kind of in the Windsor-Essex context, but I'm sure this is applicable, like I said, everywhere. So thank you so much for being here, Marissa Gatfield.
Well, thank you for having me, Cameron. I'm delighted to be here and have the opportunity to reach out to Masons, not only in Windsor-Essex, but beyond, to enlist your support over the holidays.
So let's start with, it's one of those questions that seems so obvious, but I think it's still a very good place to start. Why is it important for Masons, or anyone really, to donate blood if they can?
It's so important for anyone that is eligible to give. It's truly a gift that someone can give today to help someone wake up to a healthier tomorrow. So every minute of every day, there's someone in Canada that needs blood, and oftentimes from more than one generous blood donor. So for example, it can take up to 8 donors a week to help someone that is undergoing leukemia treatments for leukemia. And blood is used for many medical treatments, such as accidents, people that are bleeding internally, cancer, surgeries, shock and burn victims, people with autoimmune diseases, undergoing dialysis, prenatal babies, women sometimes in delivery are in need of blood and blood products. So it's probably one of the most direct ways that individuals can help a Canadian patient in need of blood and blood products. And I just want to share that in my personal life, blood and blood products, number one, have saved my son. He developed an autoimmune disease when he was just under the age of 5. He was 4, actually. He was going to turn 5 in September, and this all came down very quickly in July of that year, and he was diagnosed with Kawasaki disease. So if it wasn't for the generosities of donors donating blood, my son perhaps wouldn't be here, and I don't even want to think about it today. So I'm forever ever grateful for the generosity of donors. And another incident that just happened recently is my father. He ended up having a tragic accident, and he required a lot of blood and blood products, and it really helped him fight. But unfortunately, his injuries were too large for him to overcome, but it allowed us an opportunity to spend more time by his side. So we are forever grateful for that.
And how, because when you got in touch with me about Masonic support over the holiday season, you were specifically referencing the holiday season. How does the holiday season affect blood donations? Do you find people are just so busy during this time of year with so many things going on, it can be harder for them to remember to schedule an appointment? But does it go up? Does it go down? Just how does this time of year affect blood donations?
So you're right, Cameron. I mean, it's a very, very busy season. So, a lot of times people don't have blood donation top of mind. We are only accepting donors by appointment. So it's really important to schedule ahead to make that time to come out and donate. I mean, as the economy opens up, more people are gathering and enjoying social activities. So it's not always top of mind, but doing it as a family, coming out and booking those appointments consecutive and giving blood as a family is a beautiful tradition that individuals can start, or encourage those within their family, if they're not eligible to donate, to do so.
You mentioned only taking scheduled appointments right now. Is that related to COVID-19?
Well, since the onset of COVID, we've actually reduced the number of appointments at our donor center in order to maintain physical distancing. So at this present time, we are only accepting donors with scheduled appointments. So we are seeing fewer donors in order to maintain physical distancing. And those that have scheduled appointment, we really encourage people to keep those appointments. And if they need to cancel due to an emergency, to please, do so, but really appreciate those life-saving gifts. Every donation counts.
And yeah, that would probably be the biggest challenge, or one of the biggest challenges I'm assuming Canadian Blood Services has faced over the last couple of years is maintaining donations during COVID-19. I can speak for myself. I've donated during COVID-19, and I can only speak for Windsor-Essex, but I can say I was very impressed with this professionalism and the safety measures put in place to make sure that the process was as safe as possible. And the extra steps taken to make sure that people were being screened appropriately. But just how has Canadian Blood Services, how has, for maybe people who haven't donated since the start of the pandemic, how has the process changed in terms of donating blood? And I guess, how important is it to Canadian Blood Services to keep the donors safe during the donation process?
Well, safety is our top priority for our donors, our volunteers, our staff. The way that we collect blood has not changed, but we've implemented a lot of changes due to COVID-19. First off is the wellness checkpoint, right? So where individuals will read a series of questions and ensure that let's say if they answer yes to any one of those, they're not even permitted into the donor center at that point. We provide all donors, although you need to wear a mask upon entry into the building, we provide all donors with a surgical mask to wear on top of their current mask, or just remove the mask that they have and put it on. We have physical barriers in place. Donors are seated in the center, 2 meters apart. The beds are 2 meters apart. The screening booth, as I'd mentioned, with physical barriers, where we can't maintain that physical distance, are in place. We've increased our active hand hygiene, as well as thorough environmental cleaning between donors. So you may have noticed that when you come in, that everything is wiped down. Once the donor leaves, stylus pens are wiped down. Everything that we use is to ensure that it's disinfected.
And for any Mason, or anybody for that matter, who has had COVID-19 and recovered from it, are they still eligible to donate? Is there like a waiting period from their last positive test? How does and knock on wood, they've recovered, how does a positive COVID-19 test affect one's ability to donate blood?
That's a really great question. So if someone has been diagnosed with COVID-19, or have someone that they know that in close contact that's been diagnosed with COVID-19, they're not eligible to donate for 14 days after the person's full recovery. So if someone's tested positive, or someone that that you're in close contact is tested positive, you need to wait 14 days after their full recovery. If you've developed a fever or cough after close contact with someone who is tested positive, or developed a fever and cough within the 14 days of travel outside of Canada. So currently, if you're traveling outside of Canada, and that's crossing the border, the US border, you need to wait 14 days before you're eligible to donate blood. So this is a big question, and I would certainly, for individuals that maybe have someone that they've been in close contact or may have had a positive COVID-19 test, I would certainly recommend them to call our toll-free number at 1-888-2DONATE, so 1-888-236-6283 to discuss their eligibility with one of our information nurses.
And you mentioned, because actually, to be honest, I've never quite understood what it means, the term full recovery. So let's say I was diagnosed with COVID-19 and today I test negative. Do I then wait 14 days? Would this count as my day of full recovery, the day I test negative? Or is it 14 days as of the day I was first diagnosed?
Right. So it's from the date of your recovery, but this is also a question that I'm not, shall we say, I'm not qualified to answer because that is not my expertise in the nursing department. So this is why we recommend that people call the 1-888-2DONATE number to get, so that way their individual case, you can speak to a nurse that can provide you with the proper guidance and information that you need in order to proceed.
Perfect. And I'll put the phone number down in the description.
Thank you.
And I'll put down the website as well.
Thank you.
Now, does someone's vaccination status affect their ability to donate?
So no, it does not impact. If you receive the COVID-19 vaccination, you are eligible to donate. So donors who receive Health Canada approved COVID-19 vaccines do not require a deferral period. So if you receive it, as long as you're feeling well, you're eligible to donate.
Okay. And for any individual, my dad is in this boat, for example. He donated blood for many years. Then he required blood, but now he's at a point where he's not eligible to donate anymore. And I know many individuals who either Mort Brodsky, who donated many times, Mort 125 times, but is no longer eligible, and others who just were never eligible to donate blood for any reason. How can they support Canadian Blood Services?
There's many ways, and thank you for asking that question. For those that are able to donate, we certainly encourage them to book that life-saving appointment, but there's many ways to engage with our organization. Advocacy, just sharing the importance about blood donation and sharing that message with family and friends, your networks, the importance of coming out and donating blood, the impact that blood donations have on patients in need. It's one of the most direct ways that someone can help someone in need. It's a beautiful gift if you're able to give. So advocacy is one way. If someone is between the ages of 17 and 35, encourage them to join the stem cell registry. Right, so just go on our website, or this is being broadcasted worldwide. There would be a stem cell registry in their prospective country that they can certainly sign up and become a potential match for someone that is in need. The other way of donating is donating your organs and tissues. Talking to your family about your decision to, if something were to happen and you weren't able to make that decision on your own, about the intent that you would like your organs and tissues donated. The other way that individuals can help is by volunteering. Visit our website at blood.ca. There's so many volunteering opportunities, whether it be at our permanent collection sites or at our mobile donor centers. We certainly would encourage people to help support our centers. And the Masons have been so supportive for many, many years as a partner. I mean, even before Canadian Blood Services came into fruition, we came into fruition in 1998. So in the Red Cross days. So it's an amazing, beautiful history of love and support and wanting to help your fellow persons, right, in need of blood and blood products. So that's just beautiful. The other way that individuals can help is through a financial donation, whether it be just a one-time donation or perhaps even a legacy donation, a monetary donation, in order to help support our national programs, our research programs that are in place. These all help further Canadian Blood Services in helping us meet the needs of Canadian patients across the country. And, with stem cell donation, it could be across the world, right?
It's and I appreciate you bringing up the partnership between Masons and Red Cross and then Canadian Blood Services. When I joined in 2007, I joined Freemasonry October 2007. Blood donation was one of those things, at least in Windsor, or Freemasonry was one of those things that was kind of synonymous with blood donation. I remember at meetings, there was usually somebody who would stand up and they would have like a list of all the Masons who donated, that month and what number they were at. And then more broadly, for example, because he made it to 125, he had a, this celebration, and he kind of received a plaque that was all done at the Masonic Temple as part of his lodge. And I think that's true for other places too. I've talked to other lodges where blood donation and Freemasonry were kind of synonymous. It's unfortunate. It seems that for many reasons, Freemasonry doesn't talk about blood donation as much as even when I joined, but we should be. So I'm happy to have you on the podcast to, kind of once again, hopefully encourage everybody, but particularly Freemasons, to take the time to, it's busy. We're all busy, but take the time to donate blood. So I know we talked about it, we touched on it, but just quickly, the donation process itself, how does one go about scheduling an appointment? Where do you go for it? And then just what type of things should somebody do before their donation appointment to make it go as smoothly as possible?
Well, great question. So we've made actually the process of scheduling an appointment, because it is by appointment, on multiple different ways that you can do that. So you can visit our website. If you don't have an account, you can create an account and type in the area, like for Canada, for example, Windsor. So you type in Windsor, Ontario, and it will bring up dates that there are appointment times available. So you can actually schedule a time that is convenient on a day that is good for you automatically on our website. So visit blood.ca. We have a free app called Give Blood app, where it makes the donation process very easy to schedule. It's really, really cool. It's got some amazing features on it. Your donor card is an electronic donor card. You can join a team. You can, there's updates that are provided. It provides you your last bleed time, what your hemoglobin level was. So really great information. If you're taking medications, the Give Blood app even has an area where you can store that information, so that when you're at the donor center, if you forget the name, you've got it with you right on your phone. So it's pretty amazing stuff. So the Give Blood app, I would encourage people to download, and great information, great way to stay connected with us in this digital world, and book that appointment. So easy to do. And the other way is by calling our national contact center. So 1-888 to donate. So 1-888-236-6283 is another way that individuals can book an appointment to donate blood. As far as the donation process, a few tips that I would like to provide. Number one, make sure that you bring ID when you come to our center. Drink lots of fluids prior to your donation. Make sure you've eaten and had a good night rest. These are all helpful tips to make your donation process go as smoothly as possible. And then actually the actual screening, your eligibility is actually determined at the blood center by one of our donor care associates. So So eligibility is determined there. The actual donation can take anywhere between 5 and 15 minutes, depending on the individual. We do have a little bit of a rest period on the donation bit, just to make sure that you're feeling well. Refreshments, as part of our COVID protocols, we don't have any tables and refreshments, but we do have chairs, a few chairs in our refreshment area that we encourage donors to sit for about 5 minutes after their donation. And then it's the snacks, grab and go. So before we were able to consume them in our centers, but because of COVID and the removal of the masks, we do have refreshments set out on our table that you can pick what you'd like, and then consume them once you leave the building. So I hope I've addressed your question.
Absolutely, yeah. A lot of that stuff, right? It's stuff I've heard before, but it's always good to reemphasize the importance of you want the donation process to go as smoothly as possible. So drink lots of fluids, make sure to eat something.
Yes.
Don't be going in there hungry and thirsty and tired and all that. Make sure you take care of yourself. It makes it easier for everybody.
Yes. So that is probably, and eat something salty. Eating something salty prior to donating is recommended. So we have lots of salty snacks to take with you, whether it be chips or cookies, whatever you'd like. You're welcome to take that with you when you're done your donation process. The other thing is too, I always say that, you've come out and taken the time to help save a life, right? Be kind to yourself. Right. So take it easy that day. No strenuous exercise or heavy lifting. You're saving a life normally within days. It's being used as transfusion medicine for a patient in need. What a beautiful way to give back to your community and beyond, really, to help someone that is in need. And I know that the holidays are busy, but always think on the other side, there's someone on that receiving end that's really counting on that support. And it's a beautiful gift if you're able to give.
Absolutely. And I think everybody, whether you know it or not, will know somebody who has benefited from blood transfusions, from the need for blood. And you yourself, who knows? My dad always said he donated 10 and he got 9 back, so you never know when you yourself might end up needing it. So it's just a good thing to do for your community. And one thing I love about about Canadian Blood Services is it feels like it's this kind of like sea of tranquility amongst, because everything nowadays it can be so controversial and there's always fighting about this or that online or whatever it is, but I think everybody seems to recognize at least the importance of blood donation, right? And Canadian Blood Services is one of those organizations that it seems to have done a really good job at, people recognize the value of it, and they understand that the blood is going. It's just really, you guys have done a really good job of helping people understand why it's so important and explaining the process well. And like I said, every time I've donated to the staff at the Windsor-Essex blood donation clinic, it's always been terrific, super professional, super safe during COVID. And even before COVID, obviously, it always felt safe and sanitized. So they do a terrific job. And yeah, thank you so much for all that you guys do for, helping to give the gift of life.
Well, thank you. And I really thank you for the opportunity of having the opportunity to speak, and hopefully encourage a few people to come out and donate, advocate, join Canada's Lifeline in a way that they are able to support us. So there's many different ways. The Windsor Donor Center is open extra days a week after the holidays. We're open on January 1st. So lots of opportunities. We really encourage and thank you very much for number one, having me and helping those patients that are in need of blood and blood products.
And actually, before we go, one thing we should mention is, so I am part of Harmony Lodge and Windsor Lodge. They are part of the Essex district. So that includes both Windsor, Ontario, the city itself, but also lodges in the county: Leamington, Essex. Um, so Amherstburg. So the Windsor location is, a stable location. But over the holiday season, will there be pop-up clinics happening in the county?
So great question. Actually, in the new year, we have Leamington in the first week of January. So normally, typically for donations, the hardest time for us to collect is right after the 24th onward, right into the first week of January, where people are normally like visiting family and whatnot. We do have a clinic in Leamington. Like I'd mentioned, the best thing to do is for individuals to visit our website, put in the location like Windsor, Ontario, put the kilometers, and then all the available mobile events will come up. But I do know that we have Leamington coming up, and it's in need of support as well. So if there are many Masons, their families, their friends that can help support that blood donation event, that'd be greatly appreciated. Again, it is by appointment, and we certainly encourage anyone that is able to certainly book. And we have, like I'd mentioned earlier, 3 ways. You can visit our website, create an account if you don't have one. To book an appointment, you can download our Give Blood app or call the 188 to donate. It's a wonderful resource that we have. So please, we encourage people to do so, to use those resources.
There you go. And Leamington Lodge pop-up clinic is coming your way. So get ready, check it out. And Marissa, thank you again so much for taking the time to be here on the podcast. And to you and to Canadian Blood Services, all the best this holiday season.
Well, thank you for having me. And one thing I wanted to mention, I'm not sure if everyone knows where the location of the Windsor Donor Center is. Do you mind if I provide
Absolutely.
the address? Okay. 3909 Grand Marais Road East in Windsor. So that is where we're located. Our hours of operation are on our website. So please look us up and book that appointment to donate and help save a life. Thank you.